Macias, and I'm going to be dissecting the respiratory tract, which I've already started. The larynx sits right on top of the trachea. The trachea, you can see with the ring-like structures on the tubing. The thyroid gland is this little flap right here that sits on top of the trachea. The thymus, if you can see the heart, wraps on the very top portion of the heart. Doesn't have anything to do with the respiratory system. It's just a hormone that helps release. It releases hormones to the body. The right and left primary bronchi, it's very hard to see, but if you open the lung on the right side, it attaches into the right portion of the lung. The left side's the same as well. It attaches to the left side of the lung. So the lobes, you have your superior, middle, and inferior portion of the lobe of the right side. The left side is just two, which here's your upper portion, the superior portion, and then after you pull this flap, you can see the inferior portion. The diaphragm, if you lift the heart, this little flap right here represents your diaphragm. The hilus, I've tried so hard to find the hilus, but there's so many pieces that are holding it across. But is after the bronchi separates into the lung, it's the ring-like portion that first enters the lung itself. So the visceral and parietal pleura. The parietal pleura is the lining that sits like around the thoracic cavity, on the lungs, right below the diaphragm. It's just the lining of the lungs itself. The visceral pleura is the slimy stuff that sits right on top of the lung itself. You can feel the difference right here between the two, and that just helps with the friction of the lungs that makes it slip across each other. The disease process that I chose is pulmonary hypertension, which involves the arterial pulmonary artery that gets affected, that sends blood flow to the lung. Basically what happens is sometimes calcification, or just the way that the heart pumps over time begins to narrow or block the blood flow entering the lung, and decreases the blood flow to the lungs. Now that what happens is over time you're making the oxygen decrease, because less blood flow to the lung is going to be the way oxygen can attach to the flow of blood to the rest of the body, decreasing and making it hard to oxygenate.